Facebook. Hello, I'm John Bocanegra with KCBD, and on today's Facebook Live, Dr. Kurt Lovelace is talking to you about how Yellow House Dental and Implant Center has been holding up during the pandemic, as well as a few dental tips. Dr. Lovelace is a dentist and partner at Yellow House Dental, and he's taking time out of his schedule to have a talk with us on Facebook Live. Sir, how are you?
I'm good. How are you?
I'm doing well.
Good.
Facebook, if you do have questions that you want to ask, let us know in the comments, and we'll get to them as quickly as we can. And as usual, we have a slate of questions that we are going to ask you, Dr. Lovelace. First off, what happened to your office exactly when the COVID pandemic hit here in the South Plains? I know a lot of businesses in the area were affected by this.
Well, we were kind of aware that the COVID thing was becoming an issue, particularly with what occurred in Italy. And one of the biggest concerns that we had was not that we could protect ourselves from COVID, because you can, but it was just the lack of personal protective equipment that was available. A lot of that had been used up. Italy ran into a big issue where they didn't have enough hospital beds, they didn't have enough ventilators, they didn't have the PPE. And so when it really kind of got going on the US soil, which I'm somewhat familiar with, it was in Boston, was where the original kind of a start in the United States came from. My son lives up there, and so he was pretty familiar with the situation. But a company, they I think they had a meeting maybe in China, maybe not, and came back, but they all came down with it after they got back to the U.S. And that's kind of where it started in the U.S. So we were aware that things were happening. And we were aware that they were very concerned about the shortages of the PPE. And so, but we were caught completely off guard by right around March the 15th, whenever we were basically closed. And unfortunately, I'm not sure all dental offices closed, because I'm aware of some that stayed open during that time. But the state board pretty much mandated that if you were not going to die from this, it was not potentially fatal, you were not to see anybody. And a lot of it had to do with, we were going to have to use PPE in order to see the patients. And we didn't know if we were going to be able to get it or not. And so, there's still elective surgeries, and hospitals are really not ramped up for similar reasons now. Anyway, so it was quite we were expecting, the ADA had some guidelines about seeing patients, what was considered a dental emergency, and what things could we do. We were expecting that that was what was going to happen, but it didn't. The state board mandated that we had to close, except for people with potentially fatal infections or potentially fatal conditions. So we were closed about 6 weeks until it was May the 1st, when we were allowed to go back to work. And so during that period of time we're closed, I was at home doing a lot of research about the COVID, and about what measures could we take and things like that. Dr. Ricks, the other partner here at Yellow House, was seeing the emergencies, but we basically had to let our staff go. We had to put them on furlough. Of course, that's a whole different story.
Yeah.
We were very fortunate that we retained everybody when we did open back up. So it was on May the 1st that we were able to open, and we didn't know what we were coming back to. We didn't know if everybody's going to be too afraid to come in. We didn't know if there would even be any patients. That people would be so isolated that we'd just be sitting here. That turned out not to be true. It was actually, we were kind of swamped, and we really still haven't slowed down from our opening. It was remarkable. We were very surprised.
So what exactly did you have to do to get back up and running?
It's a good question. A, we had to get our employees back. B, we had to kind of retrain them. C, we had to get plenty of PPE, because every employee basically, there are different levels of concern with different people, and so we wanted available whatever it took for them to feel comfortable and safe. And so, obviously we had to go through some training with that. And we actually, even on Thursday, April 30th, we actually kind of did a dress rehearsal of our protocol of how we're going to handle patients. And I'll get into that here in a minute, what we're doing, because we do have a very specific protocol, and we haven't changed at all since May the 1st. We're still doing it the same way. Our reception room is closed. We don't allow people to come in and sit. We don't allow people to sit together. When we have staff meetings, we're wearing masks or keeping 6 feet, social distancing and all that kind of stuff. So within the office, we're able to kind of control that, but we're also able to control how many people are coming into the office at any one particular time. We won't bring 2 patients in at the same time. Mm-hmm. They're brought in individually, so that way we can keep them separated.
Facebook, if you have concerns, Dr. Love has just covered most of how they operate now, but if you have questions or anything that you want to let us know about in the comments, go ahead and do that, and we'll get to it as quickly as we can. So what were safety measures like before COVID actually hit? What were you doing in the dental office before all of this?
Dental office has been a pretty safe place ever since the AIDS thing in the mid-1990s. When I started practice, sometime way back in the last century, we didn't necessarily wear gloves. We washed our hands. We didn't wear face coverings. We, didn't wear goggles or anything like that. We just sat down and did dental work. Now the AIDS thing completely changed that. Now, now we were wearing garments and, wearing masks and I've got head covering and all these things that we're doing. So, really there wasn't that much to change from there. What did change was, and this came from the CDC's recommendation, is that we don't allow our employees to wear their clothing, what they wear in the clinic, in or out of the office. Oh. Everybody changes and would go home, and we installed a washer and dryer, and so we launder all of our scrubs and things in-house. They don't go out, and so that way we can kind of keep it very controlled in here. So that was a big change. And then the N95 masks and the shields and we've got some suction devices to help reduce aerosols. So those things were all the things that we added, because the aerosols, they've always been there, but we just weren't all that concerned about them until we start finding out that COVID is an airborne disease. And so then people started getting concerned about it. So anyway, that's the big things that have changed. And the employees and the doctors have a much more heightened awareness of making sure that we're wearing the proper clothing, and that we're not taking chances to unnecessarily expose either patients exposing us or us exposing the patients. And we've been very fortunate. We've had a couple of people who had some exposures, but they were outside the office, and we haven't had anybody get COVID. So that's good.
I think what's great about this is that it heightened everybody's sense of hygiene and cleanliness.
Oh, yeah, there's no doubt.
So is there any difference like in your waiting area or something like that?
Well, basically our protocol is this now. People wait in their car. And so when they drive up, they text or call us, tell us what car they're in. And so the assistants or the hygienist go out to their car. They take their temperature in the car. Anybody with an elevated temperature, we just reschedule. So we take the temperature in the car, and then they escort the patient into the operatory. And through the front door, we pass the front desk. Don't stop at the front desk. We pass the waiting room. We don't stop there, and they take them directly to the operatory. We have them wash their hands, and we have them rinse their mouths with a solution called Paradex, which is an antimicrobial mouthwash. The hygienists are using peroxide in water to have the patient wash. And then we seat them in the chair and perform whatever work we're going to do. And so we won't even let the patients touch doorknobs. The assistants have wipes, sanitary wipes that they'll handle the doorknobs with. And we open all the doors for them. And so by doing that, we're just reducing the risk of anything getting left or anything happening. And again, it's honestly, I don't see it changing very soon because it's working extremely well, and COVID's still around. So, but
any of the slightest concerns, Facebook, about anything going into the building, stepping into the chair, whatever, I think Dr. Lovelace pretty much covered all of that. So you mentioned the CDC, the Center for Disease Control, and the ADA. Which guidelines are you using for your additional measures? The
Well,
CDC, the Texas State Board, the Texas Dental Association, or so?
yeah, it's kind of an alphabet soup thing. CDC, ADA, TDA, TSBDE. So the American Dental Association and the Texas Dental Association are associations of dentists. I'm a member of both of those as a dentist, and that's kind of our trade organization. They are not a regulatory organization. Now, they lobby for regulatory changes, and they obviously have. There's been several things happen that, like the WHO's report coming out that's saying that you should put off dental procedures. American Dental Association jumped on that pretty hard, saying no, because what we found is that has not been a good thing at all. Those are trade associations, if you will. Mm-hmm. The CDC is a government agency that is more. They gather data and they make recommendations, and so the CDC does have recommended guidelines, and a lot of what I just talked about, how we're getting people in and out, is part of the CDC guidelines. The advice that we've been given. The ultimate organization that controls and regulates dentistry in the state of Texas is the Texas State Board of Dental Examiners, and they have regulatory power. They were the ones that said, you have to close except for emergencies. And they were the ones that, when the governor came out and said, I'm going to let everybody open up on May the 1st, that was on a Monday, I think he said that. Well, we didn't find out until 11 o'clock Thursday night that we were going to actually be able to open, because it was the state board that had to say it's okay.
Oh, okay.
And so there was some 11th hour negotiations going on between the Texas Hygiene Association, the Texas Dental Association, the governor's office, and the state board to kind of hammer out a temporary regulation on how you could operate in the COVID. And so they wrote a regulation, and it was finally approved, and the governor signed it at about 11 o'clock on Thursday, and we opened it up at 9 o'clock the next morning. And so, we were doing our rehearsals going, we think this is what's going to happen, but we didn't know. But there were enough people that needed to see us that, even though the 1st of May was a Friday, we were open, because, there was just a backlog of things that had happened. So the state board is the one that gets to really dictate this. And so right now we're operating under their temporary rule for the COVID thing, and it's pretty specific, and it's got the things about taking temperatures, the employees. I didn't mention it. We take our temperatures twice a day, just the employees within the office, when we walk in the door in the morning and after lunch. And so anybody with a fever, that we're not asking questions. You get the day off. So anyway, it's pretty well been laid out how we're supposed to be doing this. And so we're trying to follow that the best we can.
I think it was kind of good for you to pull back that curtain a little bit to understand, because everybody hears CDC and these government organizations and they think, oh, what they say goes, but it actually filters through all the way down to the state level for businesses like yours, or even any other ones.
Ultimately it is state regulated. Every state in the United States has its own board, and it has its own laws. So the laws in New Mexico and the laws in Oklahoma and the laws in Louisiana or Arkansas, which are the bordering states, they're different. Mm-hmm. They're similar, but they have different rules. And so, that is all governed by the state boards.
Let's talk about your patients a little bit. Have you seen any impact from COVID-19 on changes in patients' dental needs?
Very much so. As a matter of fact, I'm kind of astounded. Being closed 6 weeks, the number of things that we were planning on doing that we had to cancel when we closed, that a filling by the time we were able to get to it had become a root canal. I've seen a bunch of that where I could have filled things in March, but we get to it the 1st of June because we didn't open full speed. We were only seeing about 4 patients each a day. when we opened up. And so we had a tremendous backlog. And so by the time we got some of the people back in, things had changed from a filling. It had gotten to the nerve of the tooth. And now all of a sudden we're doing root canals. The number of cracked and broken teeth that I have seen since we've reopened, it just is astounding to me. As a matter of fact, there was an article, I think maybe Yahoo carried it just recently, about just the rash of broken and cracked teeth that have occurred. And part of it is, I don't even ask people if they're under stress anymore. We're under stress. Everybody's under stress.
Yeah.
A lot of stress between, the election and this, everything being shut down and businesses being shut down. Everybody's wound pretty tight right now. And so, yesterday I saw two people that had cracked teeth. I mean, they said, I can't chew on that side. You look in there, you don't see anything wrong, but there's a technique you can use to test it. And we test it, and sure enough, they've got a cracked tooth. And so what do? You put a crown on the tooth, but it's, it's fixable, but, crown's a big deal. So, but I've seen a lot of that. And then people not getting their teeth cleaned as regularly as they were, they're just, the maintenance is not as good. Looking back on it, I really think it was a mistake for us to close down. And I know the American Dental Association, okay, back to regulatory versus advisory, the American Dental Association is really lobbying to make dentistry essential. That, you could take your dog to the vet, but you couldn't go see your dentist. It didn't seem right to me. Yeah. So they're really working hard on getting that terminology in there so it doesn't happen again, because we have seen such an impact on people's dental health. So, people need to stay on top of that stuff. It'll get away in a hurry.
What precautions can people take to keep their mouths healthy right now, especially if they feel nervous about being in public spaces? Doing some of the mouthwashes that are over the counter available would help, but it's a very simple, age-old answer: brush and floss. It's just, you just got to take care of teeth. Don't crunch ice. Don't crunch popcorn kernels. Be careful with sticky candy, because that seems to pull crowns off on a pretty regular basis. And so I've been there.
be real cautious with things. There's really no magic formula for taking care of your teeth except brushing and flossing. That's the way to do it.
Facebook, if you have any concerns or questions for Dr. Lovelace, be sure to get those into the comments. But Dr. Lovelace, if you could tell your patients something of reassurance in these trying times, what would it be?
That our team here and the doctors here at Yellow House are doing everything in our power to make it as safe and comfortable as possible for people to get their dental needs taken care of. That if they do crack a tooth and have a sharp edge, that we can get them in safely and efficiently and get their needs taken care of. I think that's foremost on our minds, is keeping people where they feel like enough precautions are being taken. And I have people tell me all the time that we're taking more precautions than most places. Mm-hmm. And so I think that's reassuring for people to know that we're really trying hard. And our team, the staff here, is really, really, really tuned in to making sure it's safe, because, they're not interested in getting exposed either. So, it's kind of a two-way street. And so they're taking this very seriously.
So what should a patient do if they start experiencing some dental issues, but they can't get to a dental office?
Well, we hope in the United States that doesn't happen very often, because, there are plenty of dentists. There are places in Texas, though, where access to care is a little bit of an issue, because, like, for instance, Hockley County. I'm trying to think of the county that's west of Hockley County, over where Whiteface and everything are. There is not a dentist in that whole county. There's one dentist in Yoakum County. There's maybe one dentist in Terry County. So, there are situations where people can't get in to see their dentist real quick. There are some over-the-counter things you can buy, temporary cements that you can fill a hole in a tooth or put a crown back on. Best thing to hold a crown back on is get some chewing gum and put a little bit of chewing gum in it and just stick it back on, because it'll stay in place pretty well. A crown has mechanical retention as well as the cement, and so usually when you put them back in, they'll stay. But the biggest thing is to try to seek dental care as soon as you possibly can, because the longer it goes, probably the worse things are going to become and the solutions aren't nearly as good.
Again, if you're a little bit iffy about getting into public spaces, especially dental offices, rewind this Facebook Live and see what Dr. Lovelace had to say about all the precautions that they are taking at Yellow House Dentist. Dr. Lovelace, thanks for giving us all that information and taking time out of your day to talk to us.
You're very welcome. We're happy to do it.
Facebook, thank you for joining us. Remember, if you have any questions after the video is over, or even a comment that you got, let us know. We want to hear everything that you have to say concerning what we just talked about. Again, let us hear it in the comments. Have a good day, Facebook.